Hello, we meet again. I'm Miss Kinan. Today I'm going to teach about health educations about breast milk, baby bathing, umbilical cord, postpartum exercise, and contraception. The objectives of today are to learn together about exclusive breastfeeding, breastfeeding technique, baby bathing, umbilical cord, postpartum exercise, and contraception method. So, as we are helping the mother who are transitioning to postpartum period after 9 months of pregnancy, we have to make sure that we can educate the mother about how to continue to maintain self-care for herself, as well as how the mother would assess any dangerous sign that might happen during this postpartum period. So the first time after we help the mother with the delivery, we have to tell the mother how to do fundal assessment. This is also what we do within the hospital. We tell them that their uterus is going to come back to the size when they were not pregnant, and we also have to teach them about the lochia, the colors of the lochias. I talked about this at the previous session, that we need to explain how much should it be, what they expect to see, what they didn't expect to see, and what is the dangerous sign. And we have to explain about how to maintain hygiene, how to keep showering, how to really clean yourself, and taking care of your hygiene. And we also mentioned about the abdominal incision. If the mother is having a C-section, we make sure that the wound is not infected. If the mother is having episiotomy, we make sure that the lacerations also healed perfectly, as well as we explain to the mother what's the body temperature that they will expect to have, that they will not get fever as a sign of infections, as well as they should have a normal urination without any leaking and without any feeling of warmth, or is like not painful during urination, as well as the bowel function or bowel movement. We expect that they will return to their normal bowel movement, which is at least once a day. And then we explain that they need to get enough nutrition, because now they are feeding also the baby from their breast milk, and they need to eat something that will increase the productions of the breast milk, as well as maintaining their own body needs. And sometimes we also have to let the mother understand that most of the time they'll feel fatigue, because they're doing double job for two human, the baby and themselves. So we ask them the tips and tricks to sleep when the baby sleeps, to really take a rest, have a nap whenever you can. And at this time, some mother will be really concerned about the weight loss, because they have put on so much weight during the pregnancy and they expected to lose it back. But then sometimes you also have to uh, let them understand that through breastfeeding you're able to put out some weight, lose some weight, and it will be really helpful also to do some exercise accompanied with that, as well as we maintain the pain care, the pain management. If the mother still feel pain, in collaboration with the doctor's prescription for pain management, we ask them to really make sure that they are taking the medications prescribed by the doctor, as well as the mood, because we are tired. This is just a new phase. Baby might be cranky. Some will have mood swings, and we just have to make sure that they understand that they have a continuous support system, and they can not be blamed for whatever happened that is not working like perfectly, because everyone has their own journey. And with sexual activity, we explain that they can continue, they can resume their sexual activity, but also needs to let the partner or the husband know whatever they feel like doing or not doing. And we also will talk about contraception to prevent any pregnancy that is unplanned by the patient. Well, the highlight to teach to the patient is about postpartum hemorrhage. So I attach video about postpartum hemorrhage, what are the symptoms and what to do with postpartum hemorrhage and how they need to really get into the hospital if they are having the signs and symptoms of postpartum hemorrhage, as well as postpartum blues or postpartum depression. So these are also in the video. So some of the women, they will have postpartum blue and postpartum depression during their postpartum period. Now, that's the danger signs that we need to we need to teach our patient. The first one is about body temperature. It should not be feverish, chillings, or flu-like symptoms after postpartum care. And then there should be no redness or signs of infections on the abdominal incision side. And there should not be a difficulty in urinating. There should not be increase in your vaginal bleeding. This is sometimes lead to postpartum hemorrhage, late postpartum hemorrhage, or sometimes also just completely infection because not doing a proper hygiene. So we just ask them to really, the mother to really make notice if she can smell any false smelling vaginal discharge, accompanied with a pain and swelling on the side of the episiotomy or by the side of the perineal laceration. We also ask the mother to notice whether there are swellings, oral masses that building inside the breast, probably lead to mastitis. So we teach them how to do breast massage. And also, if the legs of the mother have a swelling, warm, or tenderness, or painful, so we ask them to do some exercise to really make sure that the blood flow back to the heart is working well. As well as the mother start to have blurred vision, persistent headache, which is not relieved by pain medication, we ask them to really see the doctor. As well as if they are feeling really overwhelmed and really sad because of what happened in their life currently, and then we have to make sure that they are not going to harm the baby, they're not going to harm themselves, and then we ask them to really seek help. And to ask for help is better because then we can do something to help them. So we really encourage them to really talk with the medical professionals as well as their family members. These are the maternal adaptations that we need to teach, and we need to see if the mother is already adapting very well with her new role. The first one is the taking in, taking hold, and letting go phase. So we hope that the mother will be able to settle down and take the role as a mother once the baby is born. And then we will ask also about the mood. We'll make sure that the mother will have a good mood. The mother will really step into the good adaptation of being a good mother. And also, sometimes we have to consider factors that might affect the maternal adaptation. For example, the age of the mother. If the mother is very young, sometimes doesn't understand yet what to do, and if the mother already had a previous experience of giving birth, that also can affect the adaptations. Will be really easy or probably will be hard because she just forget how to handle the baby in the past. And we have to see how's the temperament of the maternal and infant. Sometimes infant will be really cranky and how the mother is handling that, and all other factors. For example, the factors of having wound in cesarean section or even episiotomy laceration. So that sometimes also contribute in the mother's maternal adaptation, as well as the interaction with the infant. Does the mother have a very good maternal touch with good verbal interaction, and mother can understand the infant cues or signals that's been given. As well as that, we also making sure the mother is really transitioning well for the parenting roles, especially in breastfeeding, parenting, and infant care. Sometimes the mother is a multiparous mom, so she needs to really make sure that every child is left the same. So the siblings rivalry might be really clear and difficult for the mother to handle, but then we have to encourage the mother to be able to perform the role very well for both of the children or every children. Now we move on to exclusive breastfeeding. So WHO and UNICEF mentioned that early initiations of breastfeeding can start within 1 hour after birth, and then this exclusive breastfeeding needs to stay at least until 6 months of life, where the baby consumes nothing else but breast milk. And we can introduce a complementary solid food as introductory food at 6 months, but then still continue to breastfeed until the baby is up to 2 years or even beyond 2 years. Now, if people ask why we have to choose breastfeeding comparing to formula feeding, then we can just let them know this picture, that antibodies, hormones, antivirus, anti-allergies, anti-parasites, growth factor, and enzymes are present inside the breast milk, which make breast milk better, far, far better beyond formula milk. Then there are a few benefits for breastfeeding mother and infant. For infant, actually, because we've seen that breast milk contain antibodies, hormone, antivirus, anti-allergens, anti-parasites, growth factors, and enzymes, we understand that it will protect the baby from gastrointestinal infections, as well as if the baby have already acquired infection, breast milk will work miraculously to protect the baby from a further infection. And also there are risks of mortality actually to baby who are infected with diarrhea, but then the infant, if they get breastfed during this time of diarrhea infections, the chance of life is higher. And also breast milk is important source of any energy and nutrients for the baby, especially when they are below 6 months. So that's the only thing. And when they reach 6 to 12 months, like half of the source of energy will come from breast milk still. But then when the baby will reach like 12 months to 23 months, only 1/3 of the energy of the baby come from breast milk. And also, breast milk can be a very critical nutrient and source of energy for baby during illness, and especially the children who are really malnourished. So what amazing about breast milk, when the mother get infected, the breast milk will modify itself to protect the baby from the infection, as well as if the baby already has infections, then the breast milk will modify its component to really help the baby to get well very soon. And in a long run longitudinal research, it has been found that the child and adolescents who has been breastfed, they are likely to not be overweight or obese, and they will have a better intellectual performance at school, and also become adult with higher income compared to those babies who are not breastfed by the mother when they are young. And I want to address one thing. In postpartum care as well as in baby care, everyone has different journey. So every mother has their different journey in breastfeeding as well as in postpartum care. That's also for the baby. So we have to encourage our patient to understand that every single person in the world is having very different story, very different journey. Sometimes you are tend to compare yourself with others because they are doing the same, but then actually not every single person will have the same outcome, because basically we are just different one person to another. So we just have to remind the mother to take it easy, that your journey of postpartum care and your journey of breastfeeding your baby as well as your baby learning to breastfeed will be different than your friends, and that is normal. And in exclusive breastfeeding, we also learn, as I mentioned before, the benefit breastfeeding for infant and benefit breastfeeding for mothers. So for infants, allergies are less likely to develop, immunology as better prevent infection, less less case of gastrointestinal infection, respiratory tract infection, lower incidence of diabetes, asthma, obesity, and then actually the component or the one that inside the breast milk will always meet the nutrition needs of the baby according to their age, as well as that breast milk, it's really very easy to digest, and then the nutrients are actually very well absorbed, and there will be protein, fat, and carbohydrate that is really according to the needs of the babies. And as well as we don't need to worry about diluting breast milk, as well as there should not be like less likely contaminated breastfeeding, because you're just breastfeeding it from your breast, so you don't need to use any bottles or water or anything that will increase the chance of contamination. As well as there will be no sign of overfeeding. Baby will just be satisfied with breast milk. When they're full, they will let you know. When they're hungry, they will let you know. And the baby with breast milk will less likely to have a constipation. For the mother itself, as the uterine is still involuted, so having breast milk or giving the baby breast milk will increase the production of oxytocin that will give the milk out, as well as do the job of shrinking the uterus to the normal size, as well as when the mother is breastfeeding, the mother will delay the process of the menses, so there will be delayed return of menses for the breastfeeding mother, as well as delayed in ovulation. And for breastfeeding mother, there will be less chance of incidence of cancer, as well as the privilege of mother can rest while the baby is sleeping, or once the baby is feeding, mother can have a low time for herself as well. And then actually with breastfeeding, the mother is going to have or going to try to have a nutrition balance, and with the frequent skin to skin contact during each breastfeeding, it increases the bonding between mother and child. And this breastfeeding method is actually convenient because you can just use your breast without needing to wash bottles and everything, and sometimes it's economically cheaper than feeding with formulas, because you don't need to spend money on buying your baby milk, and an infant less likely to get ill because of the compositions complex that is inside breast milk. And if the working mother is working, we just need to teach the mother how to do the breast milk pumping and storage of breast milk, so that then the infant will really exclusively have the 6 months period of breast milk exclusively. And in traveling, this will be easier because the mother don't need to prepare any bottles, warm water, milk powder, but then just bring the breast and feed everywhere whenever it is needed. So it's important to assess the breast before breastfeeding, and as we teach the mother to adjust to her new role as the mother, we encourage the mother to really choose breast to breastfeed the baby, although maybe some moms will still not choose to breastfeed the baby, but we encourage them to really choose to breastfeed the baby. And after birth, the nurse and the midwife, they can assess the mom's breast to see how ready the breast is for the breast milk. I believe that God has created breast to be ready for feeding once the babies arrive. So first 2 days after birth, the breast will be soft as usual, but then on the third day, it might be a little hard because the breast milk and the milk ducts start to be producing milk and start to be filling. And then on the fourth day and the fifth day and so on, the breast will feel a bit tighter, harder before breastfeeding, and once the baby sucks the milk out, the breast will feel very soft. And we have to remind the mother that the breast milk production is according to the principle of supply and demand. So the higher the demand, the higher the supply. It means that you have to keep feeding your baby to increase your supply. And we understand that everything starts in hypothalamus. So once the baby starts sucking, then hypothalamus will release prolactin to increase the milk production, as well as the oxytocin to let down reflex, and the milk will be released to the baby. And this is what we need to educate the mother. Sometimes some mother will have the thought of, oh nurse, I'm worried, I am still young, I don't know, this is my first child, will I be able to supply breast milk, will I be able to feed the baby until 2 years? I don't even see that I can able finish in 6 months. And we have to encourage, and we have to give positive encouragement to the mother that actually the principle of supply and demand is real, and in day one actually your baby do not need 150 milliliters of your breast milk. The stomach of the baby still can only contain 7 mils of breast milk at maximum size. So it means that if you just only produce a little on the first few days of life of your baby, it's okay. It's really according to the stomach size of your baby. So once you are like on the third day, you should supposed to be producing at least 20 milliliters of breast milk. And if you're producing that, you are fine. You are good. So that's the good thing. And if in a week, then the baby can eat at least until 60 milliliters, and your breast will be producing that much. As well as in 2 weeks, then one eating will be like around 100 to 150 meals for the baby, and your body will be able to do that. But then we have to explain to the mother that don't think that you cannot, think that you can do this for your babies. And now we're moving to the breastfeeding technique. So how to hold the baby, how to do the baby's breast milk feeding. So we understand that the mother, as they adapt to their role to the mother, will be able to understand the cues of baby wants to breastfeed. So the first one is that the baby begin to like wants to have milk, and then they wants to like really put the head against the mother, saying that I need milk, and then put the hand to the mouth, making a sucking or licking sound, especially making the rooting. When we put the hands near to the mouth of the baby will start to and then go to find the hands for sucking. And then we demonstrate that the will be like so cranky and wants attention to get breast milk. And after that we will learn how to like get ready, prepared for having the baby to get the breast milk. Then we feed the baby with the latching on that I've explained last meeting, and as well as to assess for letdown reflex. So we let the mother understand the letdown reflex, that the mother will feel like tingling or sensations on the nipples, and the infant will show a pattern that will make sure that the letdown effects will come out, like it will quick shallow sucking, and then slower sucking, and then audible swallowing, and then mothers will have also like cramp, because it's also releasing oxytocin for the uterine involuntary involution, as well as the mother will feels extremely relaxed. And then another sign that there is letdown reflex is that the other breast maybe leak milk, so that both breasts actually producing milk at the same time, and then because only one side is being sucked and the other is not, then the leak will become out from the other breast, and it's a normal thing. And please tell the mother that you cannot control the leak, let it leak. And sometimes some mother will use a haka to just suction the leakage of the milk, and sometimes the leaking of the letdown reflex can reach also like 50 mils in 50 milliliters in one sitting or one breastfeeding. So that's a good sign of mother is developing the supply of breast milk for the baby. Now, it's very important to understand that there are two types of latching, baby led latching and then mother led latching. And then with the baby led latching, this happened once the baby was born. We put the baby on the mother's chest and breast, and the baby will start to move to really position himself or herself to get to the breast and then start to latch by itself. And this is related to skin contact because it's keep the baby warm, but the smells and feel of the breast will be able to make the baby relocate and locate where is the breast and begin to feeding himself or herself. So this is a good sign. Next one is the latching lead by the mother. So we have a few types of breastfeed technique that we are going to learn today. One of it is football hold or clutch hold, so that we put the baby's body behind or on the side of our body, so that this is very good for cesarean mother because the baby then will not lie on the tummy of the mother where they have the incision, but then on the side of the body of the mother, hold it by the hips, and then you can hold like and support baby head and baby's back, and sometimes you can also like tack a pillow under your arms or under your hand so that you can have a stronger hold for a baby. Another position that you can do is what we call cross cradle or modified cradle hold. Cross cradle means that your baby head is on your left hand and then it's feeding from your left breast. So that's a cross cradle, and this position is actually help you to initiate the breastfeeding for the baby in their very early days, because it's like a skill. So once baby is born, they know they have to have the skill of breastfeeding, but they're not an excellent breastfeeder yet. So then we need to give them time to adjust, as well as ourselves, our body to adjust to breastfeeding, so we can be able feed the baby very nice. And in this cross cradle position, you'll be able to practice how to give the baby a very good latch, so then the baby can latch naturally in the future. Remember the principle that in every breastfeeding session, mother's skin will touch baby skin or belly to belly. So this is what we need to teach our patient in every session of breastfeeding. Belly to belly needs to meet. Next technique is what we call side lying. So this is for a patient to lie on their bed and then side lying on the side of the breast that they want to feed the baby. And this is can give a mother more relaxed time to rest and also time for baby to having a good time with the mother skin to skin. And notice that we put a pillow behind the baby or even just simply the mother's hand, and also we can put one pillow behind the mother back so that the mother will be in a comfortable position. With breastfeeding, the main important technique also is that the mother is comfortable, then the baby is also comfortable. So this process is eating normal process. So if you're eating uncomfortably, it means you're not enjoying your meal. So you have to make sure that the mother be in comfortable position, the baby also being in a comfortable position. The next we can say technique is the cradle hold. This is like the common hold that the mother will have all the time. So you just feed the baby on your lap, um, and then you can also have a pillow underneath your hands, or basically just have a chair with an armrest, so you can just tuck your arm on the chair and just going to feed the baby that way. Some mother will also buy a breastfeeding pillow. It's just like a special C-shaped pillow that you put on your hip, and then you just put your baby on the top of it, and then you just continue to breastfeed with it. So that's what we call a cradle hold. Now, how to do breastfeeding, how to teach the mother which steps to do So the first one, the mother needs to watch the baby cues. After the mother watch the baby cues, the mother needs to wash her hand and remember which one was the last empty breast. So I need to put my baby on the breast that is full. So if the last time was the left side, it means now I'm feeding the baby on my right side. Then after that, you have to get ready. Remember, the principle breastfeeding is comfortable for mom and baby. So if the mom comfortable, the baby will be comfortable. So we make sure that the mom and the baby are comfortable. Then you have to teach the mom how to squeeze a little bit of breast milk to the nipple and then apply it to surround nipple and a bit of areola. It's just like disinfecting because we never know what is it inside the breast of the mother, but you just like do that to just make sure that the nipple and areola are clean with that like sanitizer before the starting of breastfeeding. Then we try to put the baby in the desired position, which like cross cradle, football, or any position side lying that you want to do. Remember the remember the rule of tummy to tummy, so make sure that the mother and the baby's tummy is meeting each other. So then after that we do the C shape, we do the nipple sandwich. So we do the latching parts of the baby. So with your C finger you just press the breast, make like a nipple sandwich, make the nipple protruding, and then give to the nose, like position the nipple in front of the nose of the baby, and then once the baby opens the mouth, just push the nipple inside the mouth. And after that, you can see this the picture. So my mom is like making the C positions for the hand breast, this one also C position for the breast, to make sure that the latch is in the correct position. And after that we check the latch. If the baby is sucking and then you can feel his breathing or she's breathing and mom can feel that the baby is latching, then it means it's good latch. If it's not a good latch, reattach. So delatch and then relatch the baby so that baby can have a good latching. So when the baby is full, as I mentioned in my previous slide, that you just need to put your little finger in the corner of the baby's mouth and then just take the nipple out. And how long you can breastfeed is around like 15 to 20 minutes. So we expect that the foremilk and the hind milk will come out and the baby will be full and satisfied. And after that, don't forget to burp the baby. Remember also which breast were you breastfeeding, and remember which breast to use for the next feeding. And then you can use what we call feeding log. So this is what feeding log looks like. So you have like the time, what time you are breastfeeding the baby, how many wet diaper, how many dirty diaper or poop the baby was making, and what time. And then you can just write here also right breast, left breast. So then later on for the next breastfeeding you can just alternatingly switch it. This is nice to switch between left and right because then the demand on each breast will be good, so then both breasts will have a higher like supply. We try to teach the mother to breast milk 1 and 1, not 1 1 1 1, like only like choosing right breast, not choosing the left breast, because then we want to make sure that the milk duct is really emptied by every feeding. If it's not emptied, then we can also teach the mother to do the pumping for the breast so that it will be emptied and the body can start to make the supply for the breast milk. So what to expect if mother is giving a good breastfeeding, baby is full. The baby will make satisfied sound. The baby can seem to suck, swallow, and rest, and the baby will make the breast get softer after each feeding. As well as you can see that there are milk coming out of the baby's mouth, and sometimes also there will be dripping of the milk on your breast that you can see. It means that you have the let down reflex very well. And please notice that you have to feed your baby at least every 2 hours, so at least around 8 to 12 hours in a circle of 24 hours. That's why we need the feeding log, because you're feeding a lot. And we have to also notice how many wet diapers in a day. So in first 2 days of life, there will be either 1 or 2 wet diapers. In day 3 or 4, there will be more, like 3 to 4, and day 4 to and so on. There will be around like 5 to 6 wet diapers, as well as the dirty diapers. So dirty diapers is the bowel movement. So day 1 and day 2, there will be around 1 or 2 meconium stained like this, dark, very dark green. And then on day 4 and day 3 and day 4, it start to be like light green, and then on the day 4 certainly will be lighter green with yellowish. So in the first few days, only like 1 diaper, 2 diaper, and then the next days will be at least like 3 diapers dirty in a day. And the next step is how to solve with the problems in breastfeeding. Sometimes we notice that the mother will say, oh, my baby is very sleepy when it comes to feeding. It's just sleep on my breast. And then we have to make sure that we have to arouse the baby for feeding, so that he will or she will understand that when you are in the breast, you have to eat. After that, if you want to sleep, it's your problem. But in the beginning, you have to eat first. And then we can also massage the breast during lactation. And some baby, they are using teats or pacifier, and it causes a nipple confusion. So we just avoid teats and avoid all the bottle feeding for the baby. In the future, if the mother is a working mom and needs to have a substitute bottle feeding breast milk, then we can teach the baby how to substitute from breast to bottle feeding. It's another step of learning for the baby and also the parents. So you just have to make sure it will be done step by step. If you have a problem with latching, as I mentioned before, then you stop the feeding, you start relatch again until the baby latch very well on your breast. So another problem is about engorgement. So if you have engorgement, what you need to do is you just need to have routine feeding. So this is a pictures of people, mothers with engorgement. You can use a cold ice pack to just make sure that your breast become not so painful. Or you can even use a cabbage. So get a leaf of cabbage, 2 leaves of cabbage, put it inside the freezer, crack it a bit, and then when it's like really freezed, like really icy, put it on your breast and wait until the cabbage will be it's very soft, like boiled. Then you can discharge the cabbage, and then I hope that your breast will feel better. And you can also do a breast massage, as has been taught inside the laboratory for this course. So you know how to do breast massage to the mother. And if you have a sore nipple, you just express a small amount of milk and then apply it to your nipple. But you also need to be aware of the signs of infection. And if you cannot really tolerate the pain, you can take the pain medications. You can consult with your obstetrician to take pain medication, so that your nipple will not be that painful. Another thing is that if you have flat or inverted nipple, like this one exverted, this is like flat nipple, then inverted nipple, what you need to do is you can use what we call nipple shield. But not every inverted mom are happy with that. So what they do is they do the rolled before breastfeeding technique, as well as what we call the reverse pressure softening. So you can watch this video to see how it's reverse pressure softening. It's basically just press the breast so that your nipples comes out, and then once the nipples comes out, you try to feed the baby. Actually, our baby, they will understand what to do. Even we have flat nipples, they will try to really still have the technique to suck our breast and get the breast milk out of it. Another technique is that if you have a breast pump, you can try to breast pump your breast for around 3 minutes until it's like really firm and exverted. Then you can feed your baby. Another breastfeeding technique that we need to teach our patient is to breast milk pumping. So pumping can be with the hands. You learn this in the laboratory as well, and then can also be breastfed milk, breast milk pumping with the machine. So what you need to do, especially when you're doing breastfeeding stacks, because you're a working mother, you just need to wash your hands. You pump the breast milk and put it into a sterile bottle or a breast milk bag. What you need to notice to teach your patient is that once you're using a breast milk pump like this one, you have to wash it and sterilize it as the times goes on. Sterilize because the breast milk is sterilized, and we don't want contamination, which will cause the baby to have diarrhea and gastrointestinal problem. So we have to make sure that all the equipment you use to put the breast milk in is actually sterile. So you can put into a breast milk bag like this. Teach your patient to write the date, the time, and the volume. You can also write the baby's name if you want, but then not necessarily because you're only feeding one baby. So you just put the date, the time, and the volume. And then the principle of stacking breast milk is that first come, first serve. So if we see this, we have 2020, 22, 22.9, 3.10, and 11.10. So the first one that will need to be used is this one, followed by this, and then this one. And you can see here, you can see the hint milk still over here, and this is like the fore milk. So the hint milk will be colored like yellowish white on your breast milk. Then what you need to do, how to use it when it's ice, you need to tow it for the use of the day. For example, the mother works from 8 to 5, so remember that the feeding is every 2 hours. So the mother will feed the baby at 7, then the baby needs to feed at 9, at 11, at 1, at 3, and at 5, in case the mother did not come home at 5 o'clock. So you need to have like 100 meals of 5 breast milk bag to make sure that in each hour of feeding, the baby will get at least 100 mils. So what about if we towed the milk and we are not using it? So we can use the unused towed milk for shower. So you cannot refreeze the breast milk, you just have to use it for showering. Another thing is that you don't need to toad the breast milk inside the microwave. So what you do is you use a jar of hot water, put the ice of the breast milk in it, and let it thaw by itself like that. And when the mother is working, so the mother still needs to continue pumping at work every 2 hours to maintain the supply, and then transport the milk with a cooler bag and ice. And how long can we use the breast milk? So if it's pump and it's just in the room temperature at home, you can use it at 8 hours. If it's fresh refrigerated in the fridge, normal for 8 days or a week. If you froze it in a small interior freezer, it can last for 2 weeks. If it's in the home freezer, it can last for 6 months, and if it's like deep frozen, it can last for almost 1 year. And if the breast milk has been thawed after freezing, you cannot refreeze it. No, never. You just toss it away or you use it for a shower, and it can last for 24 hours. So this is what we need to explain to the mother so they will understand this principle of breast milk pumping. Another thing, after we give the baby breast milk, we are going to learn about how to bath the baby. So bathing the baby at the hospital will remove all the furnix, but this is actually unnecessary because the furnix will go away by itself. And you need to understand that at the hospital, bathing procedures are to remove all the excess blood that might be happening to stay in the baby's hair or wherever in baby's body. So we just want to get rid of those blood-borne microorganisms that might present. And then we remember that the baby can be immersed in water until their shoulder, and the degree of the water will be 38 to 40 degrees Celsius. And you can also do a sponge pop under the infant warmer. We just need to clean the hair, shampooing the hair to remove the excess blood. And we can also ask the mom or dad to come to see how we bath the baby at hospital so that they will get the health education for them to do it at home. Once they arrive at home, they can bath the baby once a day. It's okay. And we just gather all the equipment first: container or sink with warm water, washcloth, a towel, baby shampoo or baby soap, and clean clothes. And make sure that the room they are going to shower is a warm room. You hold the baby in football cradle position, wrap the baby with the cloth, and then you have to first clean and shampoo the head, because the baby can lose so many heat from their head. So what you need to do, you water it, you give water, give shampoo, water it again, and dry it instantly. And then you do the same with the face. So you clean the face with the same principle, with the washcloth, water, soap, water, and then dry it. Then after that, you put the baby on the top of surface or the bed. You open the baby clothes, sponge bath the baby with water and soap. You can also rinse the baby there, just put the water and then just dry the baby and then showering finish. Or you can tap bath the baby. So after you give the water and soap, with the soap you bring the baby inside the sink, immerse the baby into the water, and then clean the all body parts of the baby. When it's done, you take the baby out, dry it with a towel, put on clean baby clothes, and wrap it and give her breastfeeding. So where should I put the excess breast milk? Here in the water tap immerse. So put the excess baby's milk there, breast milk there, and just like in a spa, you just do the baby spa of baby milks. Next step is to do the umbilical cord care. So once the baby is showering, we understand that the cord is wet, so the cord clamping happen once the baby is born, and we need to be aware of infection sign. We don't want to see any purulent drainage or redness or edema at the base of the umbilical cord, and notice that the umbilical cord will turn brownish black in 2 to 3 days, and it will come out by itself around 10 to 14 days. So this is how it looks like when it starts. It's whitey with the blood vessel. We just have the cord clamp there, and then once it's finished, when it's dry, we just take it out, and yeah, that's it. And we just need to clean the cord with the water. So once the baby is having shower, it's also clean the umbilical cord and let it air dry. And you just put the diaper folded below the cord like this. So this is the clamp. It will dry like this, and it will come out 10 to 14 days. And just put it under the umbilical cord for the diaper. Next is what to do to care for postpartum mother. So we need to teach the mother that they need to hand wash every single time to prevent infection. We need to teach the mother how to do the breast care for their breast with breast massage. We need to ask them to take care of their incision, cesarean. With wound care, we need to teach the mother how to do perineal care because of episiotomy with sitz bath. And we can also teach the mother how to do Kegel exercise. So we hold the pelvic muscle or contract the pelvic muscle for 10 seconds and relaxes it in another 10 seconds, and we do this like around 30 cycles daily. And this also what we need to teach the mother how to do if the mother experiencing diastasis recti, because of the muscles of the abdomen is being separated. And what we need to do is we ask the mother to lay down like this, hold the tummy, and then just raise the head and hold the breath to just watch the feet. And then after that, we can also teach the mother how to do Kegel exercise. Mother lay down, feet bend, and then relax, and then ask the mother to hold the pelvic muscle, tighten it for 10 seconds, release it for another 10 seconds, and do it for 30 times. 10 in the morning, 10 in the night, and 10 during the day. So what else we need to explain? We need to explain about promoting sleep and rest for the mother, so mother can rest while the baby sleep. providing nutrition support. Mother needs to increase their breast milk supply, but by drinking a lot of water, eat oats, sometimes drink ginger tea, eat a lot of vegetables and fruit, eat a lot of protein source food, as well as rubbing. You can try also to rub minyak kutus-kutus on your breast. That will also increase the breast milk supply. And also you can do also an oxytocin massage with the minyak kutus-kutus or other oil, so that it will really increase the breast milk supply. And we also need to make sure that the mother have a good bowel elimination by drinking water. And if the mother does not have it, we can also collaboratively ask for laxative to make sure that the mother is emptying their bowel regularly. And another thing is we just promote a good body mechanism for the mother through daily walk with the baby every morning or every afternoon. Do mild exercise and prevent the mother to have a back strain. And we can also start to have the mother talk about counseling for sexual activity. So when can the sexual activity start? Because it's important in relationships. So we can teach that the sexual intercourse or sexual activity can start after 2 weeks if it's comfortable for mom and also for dad. But you can also wait until 6 weeks or 3 to 6 months. And sometimes mom will feels like not in the mood because she just feel like too much touched from the baby. And we have to teach that during the sexual intercourse, the breast can also produce breast milk during the sexual intercourse because it's all in your hypothalamus. And yeah, that just happened. And you just have to notice that to the father, because the father sometimes don't understand about it. And with the episiotomy or cesarean incision, it may be also uncomfortable during the sexual intercourse, and it can lead to pain during sexual intercourse. So you just have to make sure that the mother will be able to explain this to the parent, to the partner, or if you're happening to teach the mother with the father during postpartum teaching, you can just mention this so that it's being understandable by two parties. Now we learn about postpartum exercise. So what you can do is the abdominal breathing. So mom lay down on a flat surface, bend the knee, and then ask the mom to just simply breathe and contract the muscles of the pelvic for 10 seconds and release for 10 seconds. And also now doing the head lift. So you just lay down the surface, hands on the side, then try to lift your head to see in the knees. And this is important because we want to increase the core muscles, because core muscles has been working so hard for 9 months and it needs to be strengthened. And another one is to do modified sit-up. So do the same, but the hands is on the thigh. So you just try to lift your head, hands on the thigh, and that's what you need to do to also strengthen your core muscle. You just do this 10 sets, and that will be okay. And another thing is knee and leg rolls. So mom still lay down on a flat surface, arms wide open. Then bring the knee to the right and to the left. So you will feel the crack on your spine, which will also strengthen the muscles of your abdomen and your back. This is very important because we want to increase the mother's flexibility after a long time of not doing proper exercise. So another one is your chest exercise. So with the same position, hands widespread, bring the hands to the front and then just pull it down towards you 10 times, 10 repeats. And yeah, that's what you need to do to strengthen the muscles of your arms and your chest. Another thing that you need to do is that you will be on your floor and you will just arch your spine, doing a cat moon spine in yoga like this to just make sure that your back is arching and it's nice, but you need to like really avoid strains. You need to strengthen the back and your abdominal for this, and you just need to do the bridging. So you lie on your back, lift up your butt with the hands like this, so you can have a strong back and abdominal. Next one is you just do a stronger back. So you just sit down with the knee bends and try to pull up yourself like this, half leaning back, and then sit up, half leaning back, and then sit up. So you just make sure your core is being exercised well. And then the last part is you do the flexible body. So you stand up, bend your body, and then bend it lower, and then coming up. Just make sure that all this exercise won't put a strain on your body, and just make sure that this is done with tolerable pain. If you feel pain, you just need to stop the exercise, rest, and then you continue again when you don't feel pain. Now, the last part is about contraception. So contraception is actually family planning. So in family planning, we prevent pregnancy, and obviously if you don't have sexual encounter, then you will have no pregnancy. But then we want the mother and the father understand that we can prevent pregnancy if they want to enjoy sexual life. So what they need to do is they need to choose which contraceptive method they want to use. These are all the things that are available: the pills, the IUD, the implant, the tap, diaphragm, male condom, female condom, and the more effective one is actually implants, IUD, and female sterilization, tubal ligation, and vasectomy. So this is like a permanent condition that you cannot redo to make sure you can be pregnant. So this is like the most effective family planning ever. And you can also have injectables, the levodopa, that will cover you for 3 months. You can also have the mother lactation activating method, that you do breastfeeding and your menses will not come out. But you can also have the pills. And another thing is to have the male condom and the female condom. You can use also the diaphragm to just close the uterus from getting any sperm. And you can also use the ring to just be in the uterus to just make sure that the sperm died with the hormones that is in the ring. And you can also have the withdrawal method, that during the sexual intercourse, the cycle is being broken, like the man did not insert the sperm to the uterus, and then with the spermicide, it's like just put the ointment to just make sure that the sperms will be dead because of the spermicide, yes. And these are the advantage and disadvantage. So the most advantageous and effective one obviously is sterilization, but this advantage cannot protect against STD. Intrauterine device also effective, can last until 10 years, cannot prevent STD. Progestin implant also can last for 3 years, but again cannot prevent STD, sexual transmitted disease. And progestin, also Depo-Provera, cannot prevent STD, but lasts for 3 months. So you can just have another injection after 3 months. Another thing is oral contraceptive. It has to be taken every single day, not related to the coitus or sexual intercourse. You just have to take it daily like a vitamins. And this also did not give you protection against STD. And another thing is that you can have what we call emergency contraception, and this can be taken once after the sexual intercourse, but this also cannot prevent the STD. And then you have the transdermal contraceptive patch. This is also, you can just use and regulate the menstrual cycle, but this also cannot prevent STD. Vaginal contraceptive ring, it's also 3 weeks at a time. and no protection against STD as well. And you can also use barriers, for example the chemical barrier, spermicide, and all methods just use not making it coming with the systemic hormones, and you can just use condom, but this is the best way to protect sexual transmitted disease. So with this, you just explain to your patient how to choose on which contraceptive you need to choose. And you can also have the sponge and the diaphragm, and also cervical cap and natural family planning. So these are all barriers that make sure that the sperm will not reach to the uterus and will not meet the egg. So sponge, diaphragm, and cervical cap. But this can prevent for some STD, but obviously if you don't do anything, you will not get protection also from STD. Well, this is the pictures. So you have the condom, female condom, oral contraceptive, hormonal ring, IUD, contraceptive injections, surgical sterilizations, implant, coitus interruptus, calendar, rhythm method, vaginal deuce, contraceptive, and diaphragm or cap. So these are all the pictures of the contraceptive method. These are all the resources that I put inside the YouTube. You can just watch this and hopefully you learn a lot for this topic. And these are the references. Please feel free to ask any questions. Put it into the discussion section, and happy studying!